Hello and welcome to Dragon Bites, the Paediatric podcast. I'm Assim Javaid. For those of you new to Dragon Bites, we're a podcast series made by paediatric trainees and consultants in Wales for anyone interested in child health. Our podcasts cover a range of themes, normally with a focus on a different topic every episode. We're going to range from revision episodes for those of you sitting their written or clinical exams, right through to interviews with specialist consultants in different fields, with local charities and teams running public health campaigns, pretty much anything that seems remotely related to the world of child health. This week we have the second half of the interview between Sophie Constantinou and Sian Williams. Instead of focusing on clinical exam tips, they're going to be updating you on the changes that have recently been made to the clinical exams. So, let's get started.
Probably what we'll do now, if it's okay with you guys, is just go over the changes to the new exam. So, Sian, I know that you've been interested in the clinical exam because you've been doing the teaching programme for the Wales trainees for the last year. And from September 2019, they have got a new format to the exam. So a good place to find out lots of information is obviously on the MRCPCH website. They've got a whole page with lots of PDF documents you can download and look at the mark schemes and things like that. But do you just briefly want to tell us about what the changes to the new exam are, how it's different, possibly your thoughts on why they're doing it?
Yeah, okay, so there are four main changes, I think. So the biggest change is the marking system, and I'll leave that to last because that's a bit complicated. The other changes are in the clinical stations, the developmental station, and the video station. So the video station, it used to be MCQ style, and you would be given several videos, about 30 seconds in length, and then as is always the case with MCQs, about 5 options which are all correct, but one's more correct than the other ones.
Yeah.
And typically people would do quite badly in that station because it is hard and the quality of the videos tended to not be fantastic. So that's the old way. From September onwards, there'll be 2 video stations where you're shown a video that's about a minute long, followed by a structured conversation with the examiner about that video. And I personally think that's really good because with an MCQ, you don't have an examiner there, you can't explain the reasoning behind your answer, but at least you can discuss it with the examiner and prove that there is a reason as to why you've put that particular answer and that you're safe. So there's 2 of them and they're 9 minutes long. I think, Sophie, you made a point that they have a set number of questions after the video.
Yeah, so there's a webinar actually on the bottom of the MRCPCH clinical exam page that you can watch. It's like an hour and 10 minutes long. But basically, they've got a good bit about the video station in it, which says that, like you say, the clip is about 1 to 1.5 minutes, slightly less, slightly more sometimes. You can watch it as many times as you want within the 3 minutes at the beginning. Then you have the 6 minutes and the examiner's got a set of questions they need to get through. But then once they've got through them, don't feel compelled to carry on talking because that's it. They've just got a set number of things they want to get out of you, and then that's the end of the station fundamentally. So don't think that you've missed something if you're sitting in silence for the 2 minutes at the end. It just means that you've finished what they had on their agenda to talk to you about. There's actually, for the video station, that there's now a scenario setting the scene for the video, which is like giving you an extra little hint. So outside the station, you have like a bit of paper saying like, Johnny is 3, he's come into A&E today with problems with breathing, please assess him. And then you go in, watch the video, and he may have like stride or wheeze or something. And then probably the examiner is going to say to you, what do you see? Can you describe what you're seeing? We're guessing because of the way that the mark scheme is for the video station now, that they're going to ask you, what would you do? What investigations would you do maybe? How would you manage this patient in the acute setting? And I think that's the point of the video. They're trying to bring in the capacity of candidates to assess acute problems, because obviously the bulk of the clinical stations in the exam are going to be on like chronic conditions that fairly well patients come into the exam with your sort of chronic conditions, and they want to make sure that you've got that little acute bit down, which is good, I suppose, to make sure that they are getting their ST4s to be able to deal with acute presentations as well.
So that's the video station.
Yeah.
Then the developmental station will now be slightly different.
Yeah.
So it used to be, I think, was it 12 minutes? Something like that. And now it's 22 minutes.
Yeah.
And you'll be asked to assess all 4 domains of development rather than, as Assim said, previously it was 1 or 2. And so you will do a full assessment, and then you have the opportunity to ask the parent a couple of questions as well about their development, and then you'll have a discussion at the end. So that's a big change, really. And I mean, I think that's quite a good thing, because it shows that you're able to do a full developmental assessment.
Yeah. Which is what you've been practicing anyway, probably, on every kid you see.
So it doesn't really make a difference to your revision, apart from when you're timing yourselves. And then the penultimate change is with the clinical station. So previously you'd have 6 what they'd call short cases, which were 9 minutes each, and you would know that you'd have 1 cardiovascular, 1 neurology, and then you'd have respiratory / other, abdomen / other, MSK / other, and other could really be anything. It could be another MSK, or it could be dermatology, or
it could be some weird immunological problem, or opthal, or please examine this patient's knee, like something really random that sometimes people would get stressed out about.
So you may get those things. So, but the point is that now there is no set. So you won't definitely get a cardiovascular station, for example. So you could go into a station. It could be any particular system. And the other change is that you won't be asked management.
Yeah.
So previously you'd present your findings, you talk about investigations, they ask you a couple of questions, and they may ask, how would you manage this patient? And apparently they're not going to ask you that anymore. No. Which is interesting, and we're not sure why they've decided to do that, but that's how it is now.
Yeah. I think my impression of what they've already put out there on the website and listening to this webinar is that they aren't asking you about management, and I don't exactly know why, but to really bear 2 things in mind, the examiners are the same examiners that they were last year. They haven't got that many new ones, so just to be aware that they might still stray into asking you about management. So even though they're saying that they won't, and hopefully they won't, because that's what they're saying they do, they still might stray into talking about management. So I would still know a bit about the main, presentations that you might get in the exam, about a little bit about management. But I think why they're doing it is probably because the exam is testing the standard of an ST4, and perhaps they are now acknowledging the fact that as an ST4 you don't know everything, you don't know how to manage everything, but they're just expecting you to be safe, pick up signs, and then be able to discuss management with someone, which is probably a fairish reflection on real life.
So just to sort of consolidate the changes that I've said before I move on to the marking, the exams, so you can see the exam circuit on the MRCPCH website, but there will be 4 clinical stations, which will each be 9 minutes long, and we would probably recommend that you spend 4, maximum 5 minutes of those 9 minutes examining, about a minute presenting your findings, so that you've got enough time at the end to answer their questions, because that's where the money is.
So just on that point, before, technically you got a knock at 7 minutes, so within the 9 minutes you got a knock on the door at 2 minutes from the end, basically to say this is the end of your examination time, now you should be chatting with the examiner, whereas now that knock is coming at 6. So you've actually got a minute less to examine and a minute more for chats, and the examiner will stop you at 6 minutes and talk to you.
But that's good, because you should really have stopped examining before that knock anyway. So that's a really good thing. So 4 clinical stations, and then as we've mentioned, 1 developmental station which will be longer, and 2 video stations which will each be 9 minutes, and then this is the same as previous, so then you've got 2 communication stations as well, which are 9 minutes long, and a history taking station which is 22 minutes long, which I don't think we've talked enough about.
No, so we probably will do another podcast episode on history and things like that, but just in terms of changes to the exam, they've said that those stations are the same effectively as previously. So if you've done the exam previously and you're sitting it again this round, the comm stations will be pretty much exactly the same. They're not changing them at all. They're probably just going to recycle the scenarios they've used before, to be honest. And then the history station will be the same. But they're trying to get rid of actors, I think, and smaller children, is my impression. But it will be the same. So don't worry too much about the changes to those.
And then in terms of the marking system, that has changed a bit. So previously, you were marked per station.
Yeah, you were.
And you could fail, I think, I can't remember, it was out of 12, was it?
Yeah, you needed an aggregate score of 100 out of 120. And I think that included the ability to bare fail a few stations. Because that would get you 8 out of 12 if you bare failed. So they were like, you're okay, but you didn't get everything. You didn't quite put it all together. So you get an 8 rather than a 10 for you got everything, but you weren't exceptional. And then 12, you used to get 12 out of 12 if you got everything and you were really good and they thought you were fab. They'd give you 12. So basically it was just maths. You could fail a number of them, and if it equaled to 100, you'd pass.
Yeah. Whilst now you've got several domains.
Yeah.
And you have to be able to pass those domains rather than the stations themselves. So kind of doesn't matter on the whole how well you did in a station. It would be whether you've passed the domains across each of the stations.
Yeah.
And there's a crazy number of domains, so that we won't talk about each one, but there are 41.
Yeah, you can go on the website and actually download the domains per station. So each station has got a different number of domains, different things that they're looking for. So a clinical station doesn't test the same domains as a video station, for example, which is sort of common sense, but it's just to, go and have a look on the website. It's too much really to get into the detail. But yeah, you're right, there are 41, so it's quite a lot.
Yeah, and right, like you said, they're on the website, and it's quite good. If you go on the anchor statements, it tells you exactly what each one is. So things like, which one should I pick? Clinical reasoning, for example, and then it tells you how to get each one. And then the max available mark is 82.
Yeah.
And the pass mark is 63, so that's 76%, and that's fixed, which is lower than previously, so I guess that's a good thing.
Yes.
Previously you needed to get 83%, and apparently the domains aren't weighted, so one domain doesn't carry more marks than another domain, for example.
Exactly. And yeah, so just a point on that as well, each domain has got a max mark of 2. So I think they are, I can't remember them off the top of my head now. You've probably got them.
I've got them here. So things like information gathering and history taking is 1, clinical reasoning, management planning, communication skills, and verbal listening, communication skills. So these are all within history taking. Whilst then you've got for the, what should I pick? Clinical stations, you've got another domain which is physical exam, identification of clinical signs, and again clinical reasoning comes up in that one again. So they change a little bit according to which station you're in, but it's well worth having a look at the anchor statements.
Yeah, definitely. And download them, download the mark sheet so you know what they're looking for. Have a go at filling them in yourself maybe when you're examining your, practicing with your friends, because it gets you into the mindset of what they're actually looking for. So yeah, that can be really helpful. So I think that's probably it. I think we've covered a lot. I hope that everyone's found this useful. Like I say, we're going to be putting some really useful links up on the website probably. Going to look towards Assim for that. So yeah, check out the website for all of the links that we've talked about, names of books and stuff like that. If you've got any questions, get in touch with us and hopefully we can answer them. But we hope to see as many of you at the clinical teaching starting in September as possible. And if you want to help out with the clinical teaching as well, it's another pitch for that, really.
Yeah, please do.
Yeah, please contact me or contact Sian.
Please do.
Yeah. Fab. So any closing remarks from anyone?
I don't have a particularly wise ending, but I know you say that you're going to do a different podcast on history taking, but I think it's really, if you get bored and you don't want to listen to that podcast, make sure you practice history taking, because you do that every day, but it's very different in the exam. You get a lot less time and you have to almost do it in more detail. So you have to practice that specifically in an exam style. You must do it. It doesn't matter how good a doctor, you might be the best doctor in the world, you will not pass the station unless you practice it in an exam style several times. And yeah, that's my thoughts on the history taking station. But yeah, just lots of practice. That's all I can say. That's the best thing to do.
In terms of just like a take-home message from me, I'd say just be confident in yourself. You're going to pass the exam. Everyone eventually does, as far as I know. And it's just a case of you doing your job, just doing your job in a way that's like the driving test, where you've got to indicate everything that you're doing. But it's still just you doing your job at the end of the day. As long as you do it in a way that shows that you're used to it and you feel comfortable in that position, they're going to pass you.
I think if you're not confident, which a lot of us aren't, pretend you are.
Yeah.
Just power pose. Pretend you're confident, because then you're the only person who knows that you're not confident. It looks like you're confident to everyone else. Fake it till you make it.
Absolutely. So yeah, that's brilliant tips from our guests today. So thanks very much, guys. And maybe, Sian, we can pick your brain for history taking in a later podcast, if you like. So yeah, thanks all, and join us again next time for more MRCPCH exam revision.
Oh, what a great podcast that was from Sophie and Sian there. Some really important updates for us all to know about for these clinical exams. I didn't realise how much things had changed. I only sat the clinicals like 2 years ago or something. Oh, God. Anyway, let's go over some of the key points they mentioned there. They highlighted some of the changes that have been made to the video stations, to the developmental stations, to the clinical stations. They've gone through a quick breakdown of the exam circuit for us. They've also gone through the marking scheme, pointed out some important changes in terms of the domain and the anchor statements that we need to focus on. So it's probably worth popping to the RCPCH website, having a look at that yourself. Sophie also wanted me to point out that in the history and communication stations, they pretty much stay the same, so there might well be some actors present for those. But yeah, thanks again to Sophie and Sian. That was a fantastic update for us all. Hopefully of use to any of you who've got your exams coming up, but also to any of you who teach on these exams and want to know the changes that have been made since you sat them yourselves. If you head to our website, www.dragonbitespodcast.com, you can find some downloadable notes on today's podcast and also from previous podcasts. It'll give you some useful links that might help out, and also give you a breakdown on what we've covered. You can also get access there to our previous episodes and news about upcoming episodes. Join us next week when Stacey is going to chat to some of our local quality improvement leads about how we can make quality improvement projects work for us as trainees. So yeah, please tune in next week. Check that out. That's all we've really got for this week. Thank you for listening to Dragon Bites.
Sorry, we've got a wasp moment and it's gone underneath Asim's shirt.
Right, so while Assim is just depositing the wasp outside into the sunshine, we will.
Should I start that point again?
Maybe we'll ask Assim about his thoughts on development again.
It's very well dealt with.
Yeah, I don't get panicked around wasps.
Oh, no, you don't.
I do.
Really?
So that's why I was panicking.
The worst thing they can do is sting you and
It was within your shirt.
Yeah.